When you're setting up your Medicare enrollment, you want to make sure you're doing everything right. You want to really make sure you're not making any mistakes. Well, today I'm going to go over 4 common Medicare mistakes that are completely avoidable as long as you have all of the pertinent information. This is going to be really important to help make sure your Medicare coverage goes off without a hitch. So stay tuned. Hi, I'm Jamie Banner, and I'm the founder of Medicare by Jamie. I'm a licensed insurance agent that works specifically with people enrolling into Medicare, and today I'm going to go over 4 common mistakes in your Medicare. So 4 common things that people have issues with that are completely avoidable as long as you know what to do when you enroll into your Medicare. Before we get started, if you find the information in this video helpful, I would appreciate it if you give it a thumbs up and subscribe and leave a comment down below. And now we can dive into these 4 common Medicare mistakes. Okay, so let's start with the big one. Get it? The big one. First birthday picture. All right, the real big first Medicare mistake is not knowing the difference between a premium and a deductible. So you hear these words a lot in insurance. Premiums, deductibles, they're things you pay, but when do you exactly pay them? Let's talk about them separately. First one is a premium, and the definition for a premium is an amount to be paid for an insurance policy, as opposed to a deductible, which is a specified amount of money that the insured must pay before an insurance company will pay a claim. So best way to think about this. Premiums are paid routinely, whether your plan is used or not. So usually it's monthly. You pay a monthly premium to maintain your insurance through the insurance company, whereas a deductible is paid when you use a plan before the insurance company starts to pay. So if your deductible is $198, like the Part B deductible, you must pay that first before the insurance company, Medicare, will pay any claims. So premium, you're going to pay no matter what every month. It's non-negotiable. Deductible, you're only going to pay it if you use the plan. If you don't go to the doctor for the entire year, you're never going to pay any part of your deductible. So easy way to remember, premium you always pay, deductible you pay if you use it. The second common Medicare mistake is missing a premium payment. So like we just determined, premium payments are what you pay on a monthly basis to maintain your healthcare coverage. And with Medicare, you usually have a couple different premiums that can be paid a couple different ways. So the first one is going to be your Medicare Part B premium. And with Part B premium, you usually fall into 2 different categories. The first one's going to be if you were drawing Social Security. So if you're drawing Social Security, your Medicare Part B premium will be automatically deducted from your Social Security check. So you never really see the money. Before you receive your Social Security benefits, they're going to deduct your Medicare Part B premium from it, and it never comes to you. So it's nothing to worry about on your end. However, if you are not drawing Social Security, you're going to have to pay for your Medicare Part B on your own, and you're generally going to get a quarterly paper bill. So every quarter, you're going to get a bill for your Medicare Part B premium that you then have to set up payment for. And there's a couple different ways to pay it. The easiest way is Medicare Easy Pay, where you set it up to have that premium automatically deducted from your checking or savings account. It's an easy way. They do it every month on the same day. It takes a little stress off you. The other options are you can pay by credit card, you can send a check in the mail, or you can set up automatic bill pay with your bank. So you have 4 options to pay your Part B premium until you go on to Social Security, and then that premium will just be automatically deducted from your Social Security check. Now for your Medicare Supplement Plan, unfortunately, these are not able to be taken from your Social Security check. They're not authorized to access your Social Security benefits and take that monthly premium. So there's different ways that you pay for your Medicare Supplement Plan premium. The first way is going to be EFT, which stands for Electronic Funds Transfer. And this is just like the Medicare Easy Pay, where you set up a bank account and routing information, and the insurance company will automatically draft the premium every month on the same day. Something less for you to worry about. The other way is to do direct bills. So the insurance carrier will send you a bill in the mail to pay your premiums. Depends on the company. Some will only do it quarterly, will not do it monthly. So it really depends on that insurance company. But most people opt for the EFT because it's less of a headache and puts more responsibility on the insurance carrier rather than on you to remember to pay this bill every month or every quarter by sending a check in the mail. And this is what I do. I assist people in finding the best Medicare supplement plans, and I can set up all of this for you and show you exactly how to pay these premiums. always give me a call. My number is 833-65-JAMIE, and I'll walk you through all the steps associated with setting up a Medicare supplement as well as how to pay that monthly premium. So that's mistake number 2. Common Medicare mistake number 3 is not knowing what your Medicare coverage actually covers, what services fall under the Medicare umbrella and what services don't fall under the Medicare umbrella. So in terms of Medicare coverage, there's 2 types of services Medicare will cover. And the first one is medically necessary services. So what constitutes a medically necessary service? That's going to be services or supplies that are needed to diagnose or treat your medical condition and that meet accepted standards of medical practice. So essentially, a doctor needs to deem a service medically necessary, so it's for your health, in order for it to be covered by Medicare. The other category is going to be preventative services. Preventative services are healthcare to prevent illness or detect it at an early stage when treatment is most likely to work best. So these are things like screenings, mammograms, flu shots, things that can prevent you from having future severe illnesses. So again, Medicare covers either medically necessary services or preventative services. Now I have a video where I explain this a little bit more, and I'm going to link it down below. But that's a pretty broad thing, but there are some services that Medicare does not cover. And those are going to be things like dental care, hearing aids, eye exams, cosmetic surgery, massage therapy, acupuncture, routine foot care, long-term care, lots of things that Medicare does not say is medically necessary, nor does it prevent you from future chronic illness. So these things are not covered by Medicare, original Medicare Parts A and Part B. Now, generally, you can get standalone separate plans to cover these, but they're not going to fall under your original Medicare coverage. So it's really important to know that if you set up a massage therapy appointment and you present them with your Medicare card, Medicare is not going to pay for that. The claim is going to be denied. So it's very important to be aware before you set up an appointment or a service to verify that it is covered by Medicare. The 4th common Medicare mistake, the last one we're going to go over, is missing your enrollment period. When you're coming into Medicare, you might actually be eligible for more than one enrollment period based on your work status. So I'm going to show you real quick what those might be. The first one is going to be your initial enrollment period. So this is what everyone gets when they turn 65. And that's that big 7-month window around the month of your 65th birthday. So 3 months before the month you turn 65, the month you turn 65, and 3 months after the month you turn 65. So you have a 7-month window to initiate your Medicare Part A and B enrollment around your 65th birthday. That's usually people's first ticket into Medicare. But what if you're still working, or your spouse is still working and you're carrying group insurance, active, credible insurance through your employer? Then you're most likely eligible for a special enrollment period. And that's when you've got 8 months after leaving employer coverage in order to initiate your Medicare Part B. So if you work all the way till 75, once you hit that last month of your active, credible group coverage, you've got 8 months from that date to initiate your Medicare Part B and still be within your enrollment period. I've also got a video that explains this very thoroughly about Medicare after retirement, and I will link that down below as well. Those are the 2 most likely enrollment periods that most people have. What if you missed these? What if you didn't enroll at 65 and you didn't have credible coverage, or you went 9 months after you left group coverage? Things get much more strict because now you're falling into the general enrollment period. So the general enrollment period is for someone who did not initiate their Part B when they turn 65 and aren't eligible for a special enrollment period. And the general enrollment period takes place every year from January 1st to March 31st, so the first 3 months of the year, where you can initiate your Part B coverage. But your Part B is not going to start during this 3-month time. It's not going to start until July 1st. So if you initiate your Part B January 1, it's not going to start until July 1. So something to really think about. It's not immediate. Medicare has very strict guidelines and timeframes for when exactly your Part B can start if you initiate during the general enrollment period. So those are just 4 common mistakes I see pretty frequently in terms of Medicare that are very easy to avoid as long as you have the right resources. And when you do your Medicare enrollment, you want to make sure you got all your pieces together. Your A, your B, your Medicare Supplement, and your Part D. And that's what I do. I assist people in finding the best Medicare supplements. Always give me a call. My number is 833-65-JAMIE. Also visit my website, medicarebyjamie.com. Or you can shoot me an email, jamie@medicarebyjamie.com, and I'll go over all of your Medicare Supplement Plan options for you and explain all of the coverage benefits so you will know exactly what kind of plan you're getting. If you stay tuned, I'm going to give you a tour of my website and show you exactly how to contact me, as well as request that free Medicare Supplement quote. If you found this video helpful, I'd appreciate it if you give it a thumbs up and subscribe. Leave a comment down below. Thanks so much for watching. Hi, I'm Jamie Banner, the founder of Medicare by Jamie. I'm going to give you a quick run through of my website so you can easily navigate and find all the important links and information I provided for you. So when we get started, we're going to be right on the homepage, and the first thing you can see is you can request a Medicare Supplement Plan quote. And that's what I do. I assist people in finding the best Medicare Supplement Plan options for them. So if you go ahead and put your zip code in there and a couple other basic pieces of information, I can get you the best supplement plan quote in your area. Once we get away from there and we go up to the top, we can see the Resource Center. So if we click on the Resource Center, we've got a couple options under there. The first one's going to be Video Library. So when we click there, it's going to take you to a page that shows you all of my YouTube videos. So all my videos will be on there along with their titles, so you can easily kind of search through them and see what video you're looking for based on your current needs. There's also a button up there that says subscribe to YouTube. So that will take you straight to my YouTube channel where you can subscribe, comment, do whatever you need, and find all the videos you need. When we go back to the Resource Center, the next link is going to say important links. And that's going to be a ton of different hyperlinks that give a lot of information like finding doctors that take Medicare, maybe filing a claim if you had something, lots of different things that can take you out to show you things you can do for Medicare. And the last section is going to be guides and forms. Now, this one is really important. I've listed a ton of forms that are going to be very important for Medicare. Stuff like employer coverage forms if you're still working past 65, IRMA appeal forms, maybe if you need to check your Part B premium based on your income. I have all of that here, plus a lot of different informative PDFs that's going to give you as much information as you need in Medicare, because that's what we want. We want you to be completely educated on everything Medicare related so you can make the best and most informed decision. I've also got it up here where everything is divided into categories. So if you need to find something a little bit faster, just click one of these categories and it's going to narrow it down to things involved in that section. Again, if you have any questions, you can always call me. My number is 833-65-JAMIE. You can also email me at jamie@medicarebyjamie.com, or you can go to the website and hit the Contact Us button and you can send me a little information. I hope you found this video helpful and thank you for watching.